In this presentation, we will take an in-depth look at the posterior-superior rotator cuff muscles, including the supraspinatus, infraspinatus, and teres minor, looking at the origin, insertion, innervation, and function of each muscle. The supraspinatus is a relatively small, rectangular muscle that originates on the supraspinous fossa of the scapula. The infraspinatus is a thick, triangular-shaped muscle that originates on the infraspinatus fossa of the scapula. The teres minor is a narrow, elongated muscle that originates on the lateral border and the adjacent posterior surface of the scapula. The supraspinatus fibers arise from the supraspinous fossa, pass under the arch of the acromion, and insert on the superior facet of the greater tuberosity. The also arises from the scapula on the medial two-thirds of the infraspinous fossa. The tendinous fibers glide over the lateral border of the spine of the scapula and insert into the middle impression on the greater tuberosity of the humerus. The tendinous tissue of the attachments of the supraspinatus and infraspinatus thicken, extending from the biceps to the inferior margin of the infraspinatus, creating a stress shield for the crescent-shaped, poorly vascularized tendon that inserts on the greater tuberosity. This is known as the rotator cable, which has a similar function to the cable of a suspension bridge. Finally, the teres minor fibers arise from tendinous lamina and the aponeurosis separating the subscapularis from the teres major and the long head of the triceps, passing laterally to their terminal attachment on the greater tuberosity. Deep to the rotator cuff muscles lies the joint capsule of the shoulder. The joint capsule, along with the glenohumeral ligaments contained within, act as static restraints to keep the humeral head in near contact with the glenoid. The lateral attachment of the glenohumeral joint capsule attaches to the anatomic neck of the humerus. The medial attachment of the joint capsule is the glenoid and the labrum. With the arm in a resting position, the inferior and anterior portions of the capsule are lax, while the superior portion is taut. The anterior portion of the capsule is reinforced by the superior, middle, and inferior glenohumeral ligaments. The muscles of the rotator cuff act to reinforce the joint capsule superiorly, posteriorly, and anteriorly. The joint capsule provides little support to the glenohumeral joint without the reinforcement of the glenohumeral ligaments and the surrounding rotator musculature. There are several bursa relative to the shoulder joint. The role for the bursa is to decrease friction between adjacent structures, allowing free range of motion. These bursa include the subscapular, subcoracoid, and coracoclavicular bursa. In reference to the posterior superior rotator cuff, the subacromial and subdeltoid bursa are located deep to the subacromial arch and the deltoid. It extends laterally beyond the rotator cuff footprint. Medially, it progresses to the area of the acromioclavicular joint. It lies anteriorly to the biceps groove, and posteriorly, it lies over the posterior superior rotator cuff. An important relationship to consider is that of the posterior superior rotator cuff and the coracoacromial arch. The coracoacromial arch, as the name implies, is the complex of the acromion, the coracoacromial ligament, and the coracoid process. This structure is thought to play an important role in shoulder stability via both static restraint and dynamic interactions with other shoulder capsular anatomy, including ligaments, muscles, and osseous structures. As you can see by its position, it passively restricts anterior and superior movement of the humeral head relative to the glenoid. Innervation of the supraspinatus and infraspinatus comes from the suprascapular nerve. The suprascapular nerve branches off from the superior trunk of the brachial plexus, just distal to where the roots of the cervical nerves C5 and C6 combine. This innervation allows the upper extremity to abduct while simultaneously pulling the head of the humerus medially towards the glenoid fossa. Innervation of the teres minor develops from the axillary nerve. The axillary nerve arises from the posterior cord of the brachial plexus, which is a blending of C5, C8 nerve roots. Like the supraspinatus and infraspinatus, the teres minor abducts the extremity and works synergistically with the posterior deltoid to perform external rotation at the glenohumeral joint. The arterial supply of the posterior-superior rotator cuff stems from the thyrocervical trunk, which branches off proximally from the subclavian artery to become the suprascapular artery. This is supplemented by the dorsal artery traveling along the medial border of the scapula. The posterior-inferior portion of the rotator cuff is further supplied by the circumflex scapular artery, branching anterior off of the third part of the axillary artery. An important function of the rotator cuff muscles is to confer substantial stability to the glenohumeral joint by aiding compression of the humeral head into the glenoid fossa. Additionally, contraction of the posterior-superior cuff results in two primary actions. These actions are abduction and external rotation of the humerus.